Have you ever wondered what happens when AI gets it wrong in healthcare? Like when algorithms are starting to make life or death decisions. In 2018, there was this AI system at a major hospital, and it had flagged a patient as a low risk for pneumonia. So the doctor sent him home, and the next day he was back in the ER in respiratory distress. Why? It was because the algorithm had a critical blind spot. Hi, I'm Teresa Younkin. I'm a health informaticist, and you'll find me here each week talking about healthcare and AI. Today, what I want to talk about is the high stakes world of AI risk management frameworks, and especially how you need to apply them in healthcare. Sometimes the difference between AI success and AI failure isn't the technology at all, it's about how we manage the risks. So here's a wake up call. Healthcare is pouring money into AI like never before. In 2021, investments doubled and we spent nearly 67 billion, that's billion with a B dollars globally, on AI. Here's the sobering reality though. Many of the systems are failing. For example, there was a sepsis model that was implemented, and when that particular algorithm was independently tested, it missed 67% of actual sepsis cases, but it was still throwing alerts into the EHR. So the doctor started to ignore those alerts completely. Or we could think about facial recognition systems where there was another fail in a Northeastern hospital where they were trying to identify potential drug seekers. Well, it was working perfectly except for patients with darker skin tones. It was creating a dangerous bias, and that can lead to untreated pain for minority patients. These examples aren't just technical glitches, they're actually governance failures. And these governance failures are happening because organizations are racing to implement AI and they're not using the proper risk management frameworks. So, my caution to you is don't be another failed AI implementation because you got so excited about the technology that you forgot to ask the most important question. What happens when it's wrong? So, here are some well known AI frameworks that you can apply to your projects. Number one is the NIST AI Risk Management Framework. It was released in 2023, and it's designed around a simple, but it's a pretty powerful cycle. Number one, you want to govern. You want to build a culture where risk management matters. Number two, you want to map. So, identify what could go wrong before it does. Three, you want to measure. So you want to track how your AI is performing in real world conditions. And four, you want to manage it. So you need to prioritize and address the risks when they appear, not during the postmortem. Mayo Clinic is one example of an organization that's doing just this. I had an opportunity to talk to their AI team when I was at HIMSS this year. And what they've done is that they have assembled a cross functional team on their AI governance committee. So they have everybody from radiologists, ethicists, the data scientists, and patient advocates. And they review every aspect of the AI system before deployment. So they are starting to see faster methods of identifying critical cases, and they're doing it with 95% accuracy. The difference is they were anticipating the risks because they had all the voices at the table instead of reacting to the failures. The second framework I want to talk about is the EU AI Act, and that is the European Union AI Act. So while NIST is more voluntary, the EU is taking a very regulatory approach to AI implementations, and they divide AI risks into four tiers. And those four tiers range from unacceptable to minimal. So, an unacceptable risk, an example would be if it was deemed to be too harmful to your fundamental rights, like social scoring or emotional recognition. Those types of AI algorithms are completely prohibited in the EU. If you're a global company, you want to be thinking about this. The next level are high risk. Now, these AI systems could have a significant impact on health, safety, or any kind of fundamental right, such as critical infrastructure, healthcare, education. So they have to meet very strict compliance requirements. And those compliance requirements are risk management, data governance, and human oversight. What they've classified as limited risk are AI systems like chatbots and deep fakes that pose transparency issues and concerns. So you need to disclose when people are going to be interacting with the AI in that way. And finally, there's minimal or no risk at all. And those are AI systems with little potential for harm, like if you're going to be using AI for spam filters or for video games. There are really no specific regulatory requirements beyond voluntary codes of conduct. And we've heard discussion of that here in the US as well. When you're implementing these risk management frameworks, you need to understand that you will have more documentation, more testing, and more oversight. I know that we're stretched for resources. This is very uncomfortable to be adding more resources. It's not sexy. This stuff is not fun. Sometimes the best kind of governance is the one that's going to make you uncomfortable. One last thing that I did want to point out, there was an executive order under the last administration that was revoked, and a new executive order around how we're going to treat AI in the US. The new administration isn't going to have something ready to review probably until October. Don't just sit here and wait. Be proactive and start to look at other frameworks. We have the Coalition for Health AI, or CHAI. They're creating healthcare specific standards that are trying to fill in these critical gaps that are being missed by other frameworks. CHAI has created a responsible AI checklist. And what it does is that it translates the principles that they've identified into specific evaluation criteria across the full AI life cycle. I think that those that are going to win the AI game are creating a hybrid out of all of these different frameworks, picking out the best and picking out what suits their organization. Frameworks aren't just an academic exercise. They're practical tools, and they're going to help us to build the AI that works for everyone. If I was implementing, here's what I would do to have a successful implementation. I would start with governance, always have a multidisciplinary team before you even think about building an algorithm. Number two, you want to create unified assessment protocols, making sure that you're testing AI like you would test a new drug. Three, monitor it continuously. AI performance degrades over time. And if you're not watching it, you will start to have skews in your data and you will start to develop biases in your data. This is not set it and forget it. Number four, document everything. You need to have clear standardized templates that you're going to be using across these multiple frameworks. And you want to be able to explain it to your end users and you want to be able to explain it to your organization. Number five, I would say you need to train differently for different roles. Your executives need to know about governance overview. Your clinical leaders are probably going to be looking at oversight tools, and your end users need to understand two things. Number one, when they're interacting with AI, and number two, they need to understand the limitations of AI. At the end of the day, no framework works if it's just sitting up on a shelf. Risk management has to become a part of your organizational DNA. So, in closing, healthcare AI isn't just another cool technology. It's really about patient lives at the end of the day. And managing risk isn't about just checking boxes, it's about building systems that are worthy of our trust. An AI framework should be architected and deployed to catch problems before they reach your patients. If you're implementing AI in healthcare, I'd love to hear your experiences in the comments. This is why I offer AI workshops for leadership teams, because we help healthcare organizations not just adopt new technologies, but we act as guides to help you navigate this complicated AI landscape, like these risk management frameworks. All right. Thank you for joining me today, and I'll catch you guys here again next week on the flip side.